Thanks for joining, everyone. My name is Jane Haskell. I use she, her, hers pronouns, and I am the Director of Collaborations at SAGE, running our SAGECollab program, which is a network of organizations across the country in support of LGBTQ plus older adults. I am joined today by two colleagues from the Department of Health and Human Services. I am joined by Sarah Borland, who uses she, her, hers pronouns, and Sarah is the Senior External Affairs Advisor at the Department of Health and Human Services. I'm also joined by Nick Oka. Nick uses they, them pronouns and is the Program Management Analyst at HHS. Without further ado, I am going to pass it over to my colleagues. Please feel free to put any questions you may have in the Q&A. You can also pop them in the chat. If anything speaks to you and you'd like to comment on that in the chat, please feel free. We'd love this to be conversational. So if you have anything to add, please don't be shy. Thank you again, and I will pass it over to Sarah and Nick.
Thank you so much, Jane, and thanks for having us. We are super excited to be here to talk through the impact of the lower prescription drug cost law or the Inflation Reduction Act, which we are implementing at HHS. As Jane said, Nick and I work in HHS, but if you go double down even further, we literally just work on implementation of this drug pricing law. So every day our job is to get out the word, raise awareness, make sure people on Medicare or people who work with seniors are aware of the benefits that are available because of this law. So we're really thrilled to be here today. Prescription drug pricing is like a bit of a nerdy topic. And so there's lots of acronyms and things like that. So I'm gonna assume that you all are familiar with some aspects of Medicare, but I'll also explain thoroughly some of these policy pieces. But please put comments or questions in the chat if you would like to. So to start, what we're going to cover today is the impact of this law, what's in it, and what it means. And I will be walking through those. And then Nick will talk about Medicare open enrollment, which is upcoming, and the respiratory viral season that we're about to enter and why that matters too. So I will get into the policy first. So the Inflation Reduction Act is the name of the law that was passed in 2022 by Congress, with Vice President Harris casting that tie-breaking vote. But we like to call it the lower cost prescription drug law because there's lots of aspects of the law that affect different areas of policy, but we really focus on the prescription drug pricing impact because we know before these reforms, as many as 1 in 3 seniors could not afford their prescription drugs, and there were millions that were not managing their illnesses or going without needed chronic medications, or if they weren't going without it, they might be cutting it in half or foregoing other expenses in order to make sure they could cover it. So this was a huge priority to the Biden-Harris administration, and we're really proud to have the law signed in 2022. And then it is a massive law with a lot of reforms. So we've been implementing it piece by piece. Some of it became active immediately. Other pieces were implemented in 2023. And then we've done a lot this year, and there's more to come next year. So one of the things I'll talk about is what's actually in effect now and what's coming. So just y'all can read this slide. This law really aims to strengthen Medicare and make sure prescription drug costs are lower for people with Medicare. And I like to say, the administration has proposed expanding the effects of this law beyond just people with Medicare. There was some legislative constraints that meant that this law only applied to the Medicare program. But what we've seen time and time and again is that Medicare reforms tend to ripple out. And so we're really hopeful for any of you who maybe are not on Medicare yet, that this law will kind of be a seed change. So let's talk about what's in it. These are the kind of 6 major benefits, and I'll dive into them further in the coming slides. But $35 monthly insulin for folks who rely on insulin, free recommended vaccines if you have Part D, which is Medicare drug coverage. This year, a $3,500 cap on out-of-pocket cost, which will change and decrease even more to a $2,000 out-of-pocket cap in January, and I'll come back to that. Drug companies who raise their prices faster than the rate of inflation now must pay a penalty back to Medicare. So really reining in kind of those year-to-year price increases. And then for the first time ever, Medicare has been authorized to go to the negotiation table and negotiate directly with drug companies, which is something, if you've been a health policy advocate for a while, advocates have really been fighting for this authority for a long time. So we're thrilled to be a part of it. And then last but not least, the Extra Help program, which helps folks with limited resources or low income in Medicare, has been expanded to cover a lot more people. And if you're eligible for this program, you can almost ignore the other bullet points because you will only pay $4.50 for your generic drugs and no more than $12 for your brand name drugs. So it is just an incredible help to ensure you have limited copays at the pharmacy counter and you have no premium and no deductible for your prescription drug coverage. So the expansion of the Extra Help program is just enormously beneficial if you qualify. And so we want help getting out the word on that. Okay, so let's talk about this kind of long implementation timeline I referred to. So in 2023, the $35 monthly insulin went into an effect. We know that about 3 million people on Medicare take insulin and they all have access to this benefit now. Additionally, vaccines were made free if you have prescription drug coverage through Part D. And this includes recommended vaccines like RSV, shingles, Tdap. I always say when I'm talking to seniors, Tdap includes pertussis. That's the vaccine you have to get if you're meeting a new grandkid. Our research shows that if you wanted to get a shingles vaccine with Part D before this law was implemented, you could pay up to $200. And then the RSV vaccine is brand new, just FDA approved and recently. And last fall, we know a lot of seniors were able to access it for free because of this law. And we released a report earlier this summer that showed that more than 10 million vaccines were provided to seniors for free because of the implementation of this law in 2023. So this year, in January, 9 months ago, the expansion of the Extra Help program went into an effect. This is the program I just referred to. More people were eligible for more benefits. So the $4, $12 copays and the no premium or deductibles are those added benefits for more people. So we're really, really proud of that. We estimate there's about 3 million people who are eligible but not enrolled. So we have work to do to get out the word. And then certain people now have their drug costs covered in Part D once they reach around $3,500. And this it expands even more in January to $2,000. And I'll expand on that. And then ongoing are these drug price negotiations. And I'll explain a lot more about that in one of the next slides. Okay, I won't repeat this. I think I stole my own thunder by already telling you these awesome stats, but we're really proud of the 10 million shots in arms for free last year because of this law and Medicare. So insulin and vaccines are some of the better known provisions, but let's kind of dial in on the others. Okay, so if you have Medicare, you sign up for Part D, which is the prescription drug coverage part of Medicare. If you have a diagnosis like cancer or multiple sclerosis, and you take a really expensive specialty drug, like maybe an oncology drug or an immunosuppressive therapy, your price tag for those drugs, I mean, the list price is literally tens of thousands of dollars a year. If you had Part D before this law, you were on the hook for a lot of that. In fact, we know that some people with expensive specialty medications were paying up to $15,000 out of pocket. So when we know the average income of a senior is first of all fixed and second of all around $20,000, that's literally almost all your income going to your prescription drugs, and no one can afford costs like that. So the goal of this aspect of the law is to put a cap on those costs so you're not just paying tens of thousands of dollars, and kind of have a hard stop at $2,000 starting in January. And this year it was partially implemented at that 3,500. So for those people who are on specialty drugs, that's literally $10,000 saved, which is huge. I also like to say if you are not on one of these specialty drugs and you're like, I don't spend nearly that much a year, I think of this as the peace of mind provision because you never know when you are around the corner from a really serious diagnosis that might require expensive drugs. So just knowing that there's not unlimited cost anymore, and once you hit 2,000, you are done, is just a really important kind of peace of mind part of this that you can take with you. Okay, extra help program. I think I've already shared most of this, but just want to underscore if you make less than $22,000 a year, it's worth it to apply. The income requirements are on Medicare's website and obviously vary by family size and things like that. But we always say it pays to find out. It is, some people, if you already have Medicaid, you may already be enrolled. There's some automatic enrollment, but if you're not sure if you're in it and you think you might be eligible, you should check out the application and see if you can get into this program because it really could make a huge difference. Okay, I already shared this one as well. About 3 million enrollees could be eligible but don't know it. This screenshot I included is one of the postcards we have on our website. I'll double down on this at the end, but we have really made kind of accessible language postcards and articles and different resources a priority, and post them all on our website, which is lowerdrugcosts.gov. Because we know that many seniors are getting information from trusted community organizations or neighbors or our area agencies on aging or a state SHIP counselor. And we, rely on community leaders to help us get out the word. So these are all available on our website to download. Most of our resources are available in the 5 most commonly spoken languages among Medicare beneficiaries. So check that website out for sure. Okay, and then this, before we get to negotiation, the other provision I mentioned is what we call inflation rebates. If drug companies raise their prices faster than inflation, they pay a rebate back to Medicare. And it's lowers costs for the people who pay for that drug, but it also goes back into the Medicare trust fund. So it kind of shores up Medicare for the future and makes sure that the program is viable for future generations. So this is really kind of make sure that drug companies aren't able to increase prices at will without any kind of pushback. Okay, so really the cornerstone of this law and the most historic piece is this Medicare negotiation aspect. So since Medicare Part D, the prescription drug program, was implemented in 2006, there basically drug companies did not go to the table directly with Medicare. So Medicare didn't have the ability to kind of leverage the whole population and say, let's take into account how many people take the drug, how good the drug is, and things like that. And a lot of advocates have been fighting to change this for literally decades. And so we're really proud that this got done as part of the law. We just finished most of our first cycle of negotiation. So basically, based on what Congress wrote into the law, we were able to choose 10 of the highest cost and most used drugs in the Medicare Part D program and go to drug companies and say, we're no longer price takers, we're going to go to the table with you and talk about what the drug price should be for this drug. So we just finished that first cycle of negotiation. I'll talk a little bit about that more in a moment, but we will keep adding drugs to this. So it's 10 drugs in the first year. In February, we will announce up to 15 more, and then we will keep adding. So, within a decade, there will be hundreds of drugs negotiated through this program, which is really exciting. Okay, so this is the most timely update that we're happy to share. So on August 15th, there is our boss, Secretary Becerra. He appeared alongside the president and the vice president to announce that we had achieved agreements with all 10 of the drug companies that make the 10 selected drugs. And through the negotiations had secured discounts of about 38 to 79% off the list price of these drugs. So really, really meaningful discounts. And just to list some of these, if you watch TV like me, you may have heard of all of these because they are really, they're common to see and a lot of folks take them. So type 2 diabetes drugs, Januvia, Jardiance, and Farxiga were included on that list. For heart disease, if you take a blood thinner to prevent blood clots, Xarelto and Eliquis were included along with Entresto. And then finally, a cancer drug Imbruvica and arthritis drug Enbrel were included. So these are very costly medications. They can cost several $100s a month. And they are also just really critical for managing common chronic illnesses like diabetes and heart disease and arthritis. So just to share a little bit more about what we achieved. So we got deals with all 10 drug companies. About 8.8 million Medicare beneficiaries take one of these medicines. The savings projected are around $6 billion for the Medicare program. And the out-of-pocket costs that are estimated for when these prices go into effect, the savings estimated is $1.5 billion. So really a lot of savings for Medicare and the people who take these drugs. Okay. Before I go to looking ahead, I'm just going to double down on my please share our resources and then I'll hand it to Nick. So we have a website called lowerdrugcosts.gov. It is also available in Spanish, medicamentoosbajoprecio.gov. We'll share with Jane a lot of links and resources that folks on this call can use afterwards. But just to highlight a couple things. First, we have social media toolkit. So if you have a lot of seniors or folks in your constituencies who follow you on social media and count on that for updates, we hope you use that. We have postcards like the one I shared before available for each of those provisions. So if you serve a population that predominantly, insulin and diabetes are their concern, we have an insulin specific one, et cetera, et cetera. And then we have what's called drop-in articles. I love these. They're 1 to 2 pages, very plain language, but they're literally made so that you can copy and paste them into a community newsletter or some sort of public service announcement you send out. So, we create those so that folks can copy and paste and use it to spread word about important benefits with their communities. We also have video testimonials on this page and on our YouTube page of, real Medicare beneficiaries who are benefiting from the law already and what it means to them, because we know storytelling is a really powerful way of raising awareness and showing the impact of this law so more people find out if they're eligible for benefits. So please do check out our website. For those of you who counsel Medicare beneficiaries or, talk about, looking for a plan, things like that. If you work with Medicare beneficiaries, we really certainly hope that this stuff is useful to you. And we count on you as trusted messengers in your communities to help spread the word. So, I will pass it to Nick to cover the looking ahead items. One of them I already mentioned, which is this January out-of-pocket cap, which is tremendous. In February, the announcement of up to 15 new drugs. And then Nick is going to talk a little bit about respiratory virus season and Medicare open enrollment. So I will pass it to you, Nick.
Thanks so much, Sarah, and can't underscore, that these are truly historic provisions, and we're really excited about them. But looking a little more immediately, I'm sure you folks have seen the ads and, have been going out to get your flu shots or your boosters or anything else, because guess what? It's respiratory virus season. So hopefully you have access to a pharmacy where you can get your free recommended vaccines if you're on Medicare Part D, and that includes flu, COVID, and RSV. And we'll chat a little bit more about that. And I also wanted to flag for you all that Medicare open enrollment is coming back around. What does that mean? We'll get into that shortly, but it starts in about a month. So October 15th through December 7th is the time when you can review your Medicare plan, see if it's still the best plan for you. And if you feel like maybe it's not meeting all of your needs, you can work with a SHIP counselor or other folks to help figure that out. Next slide, please. So HHS, we have a new public education awareness campaign, and it's called Risk Less, Do More. And it's focusing on this season's vaccines and encourages folks to get vaccinated. As you folks know, respiratory viruses commonly cause illnesses such as flu, COVID, most recently RSV. And, it's that time of year. It's going to be fall here on the continent. And there's a lot of back to school. So there's a lot of shared spaces, there's a lot of shared germs. And we just want to make sure that people, are the best equipped to be healthy and safe. Um, I don't think I need to read off everything on this list, but I think the basic underline here is to talk to your doctor to make sure that you're getting what you need and to see what's most appropriate for you. Next slide, please. Once again, just underscoring a few reasons to vaccinate against flu, COVID, RSV, and to stay up to date on your other vaccines. If you think that, it's been several years since you've gotten like your Tdap or other, you know, annual or several year gap types of vaccines, talk to your doctor. You might be high risk even if you don't know it, especially those who are over age 65 or pregnant or nursing. And vaccines work best to help get you, to keep you from getting seriously ill in case you get a respiratory infection. And it also helps to protect your loved ones. If you have kupuna, if you have older adults in your life, or if you have young kids in your life, or other folks who are immunocompromised, please get vaccinated. Next slide, please. And so I mentioned Medicare open enrollment. A lot of people get a little confused, but Medicare open enrollment is a time of year you have about 2 months, October 15th through December 7th. And that's when you have the opportunity to review your plan and see, is it still the right plan for you? It may have changed. The Medicare plan that you might be on may no longer suit your needs, or the cost may have changed, or the coverage may have changed. It's a good opportunity to review all of that to make sure that it still works for you. Next slide, please. So this year, Sarah covered a lot of this already, but there's even more new benefits available because of this new lower cost prescription drug law. And so that includes the $2,000 out-of-pocket cap that she mentioned, which we're really excited about, and hopefully cuts down on a lot of your out-of-pocket costs. And then just wanting to flag that premiums can change year to year, so make sure that this still works for you. Is it still in your price? Is it still in your budget? And you can use Medicare's Plan Finder to directly compare plan costs and quality. Next slide, please. And then Sarah had also mentioned this, the Extra Help program is a low-income subsidy program available through Medicare Part D. And through the new lower cost law, it's now been expanded to those qualifying for not just if you make less than 22,000 a year or less, but if you are 135% or lower of the federal poverty income limits, and you can check that online as well. But this program helps to pay for your Part D premiums, deductibles, coinsurance, and other out-of-pocket costs. Next slide, please. And, we try to keep things as accessible as possible. So while there are opportunities to look things up online, you can also call 1-800-Medicare to discuss, especially during open enrollment, and that includes weekends. You can also reach out directly to your state health insurance assistance program or your SHIP. You can go to shiphelp.org to find different locations, and a lot of them do offer virtual counseling. Next slide, please. And so enrollees, I know we've just went over this, but if you need assistance understanding these benefits, you can go to medicare.gov. You can call 1-800-Medicare. You can contact your local SHIP. And just want to underscore what Sarah mentioned earlier about going to lowerdrugcosts.gov. Next slide, please. And thank you so much. If you folks have any questions, please let us know, and I'll turn it back over to Jane.